Good morning, my name is Torsten Beyna. I'm gastroenterologist and specialized in gastrointestinal endoscopy. I'm head of the Department of Internal Medicine Gastroenterology here at the Evangelisches Krankenhaus in Düsseldorf, Germany. I love doing endoscopy because for me it's an ideal mixture of sophisticated endoscopic diagnosis making with the option of interventional medical therapy and surgery, as well as a scientific approach. I usually start my working day with a cup of black coffee, so for myself, but also because we as gastroenterologists know very well that coffee is also protective for our liver. So today is a normal day. We will do the ward round on the private hotel clinic first, and then after that we will have a meeting with all co-workers in the morning and the radiologist to discuss difficult cases and also all patients from yesterday. This is one of the most rewarding parts of my job, to cure patients or to at least provide the best treatment possible. And on the other hand, I like to train young doctors and to share with them my knowledge and also my passion for GI endoscopy. Olympus has the slogan, "Every adenoma counts," and from my perspective this represents an optimal attitude to do colonoscopy, because we know very well that detection of precursor lesions, adenomas, is one of the biggest goals of doing colonoscopy, and therefore we have to take care that we find every adenoma in every patient that we see. We have here the EVIS X1 processor unit in place in combination with the latest EZ1500 endoscope series. The system remarks a clear step forward in my view, because the endoscope generation creates sharp images in the near field and in the far distance. So no need to switch. This is very convenient for tumor delineation, but also for therapeutic intervention. And also the NBI is not only useful now for lesion characterization, but can be used for lesion detection as well, because it's so bright. There's no need to switch to white light anymore. So TXI, for me, it's more or less a new white light that I'm using in my daily routine, because it's more or less white light imaging with a little bit of post-processing, as well as color enhancement and refinement. So exactly what I'm looking for when I want to diagnose lesions, to find lesions, and also characterize lesions. On the other hand, it's also very helpful in the context of endoscopic therapy, because it makes recognition of the layers during endoscopic submucosal dissection easier, to identify vessels. So the imaging capabilities that are delivered by the X1 platform really improve our capability to diagnose early precursor lesions or early gastrointestinal cancer at an earlier stage than it was possible before, because we can easily switch from high resolution white light imaging to advanced imaging techniques like TXI, NBI, and this is a great step forward in our journey to detect as many patients at an early stage as possible. So if the screen turns red, the endoscopist also turns red, usually. So especially our main focus in performing advanced procedures is to prevent bleeding and also to treat bleeding in order to provide patients' outcomes and safety. And therefore the RDI function is very helpful, very convenient to reduce our stress, to reduce procedure time and increase patient safety, and in the end patients' quality of life. So the generation of scopes that come together with the X1 processor unit has an ergonomic design. It's lighter, that makes it easier to keep the scope in your hand also during a long working day and long procedures. The handles are more ergonomic. You can reach them also with smaller hands, and it's easier to manipulate both wheels and the knots of the endoscope. The X1 processor generation provides, from my opinion, the best available endoscopic imaging technology that's on the market, and that will define the gold standard for the coming years. This is the end of this procedure. We had my eyes, our eyes, looking at the patient. We are very confident that we have not overlooked any polyp in this patient. Olympus empowers me by providing latest technology to provide appropriate therapy to my patients and therefore improve patients' outcomes and patient safety. And this in the end will help me to improve patients' quality of life. My hope for the future of flexible GI endoscopy is that by integration of a self-learning artificial intelligence system, we will be able to make endoscopic diagnosis, what means lesion detection, characterization, creating an overall treatment plan, less user-dependent, and also will include very important points like quality assurance, quality measurement into this artificial intelligence workflow. So this is the end of the day. We did a lot of procedures. We did therapeutic procedures in patients with early GI neoplasia. We did diagnostic procedures, so everything went well. All patients are fine, ready to go home.